You're
Hello
welcome.
and welcome to today's webinar. My name is Hazel Craven and I'm a course advisor here at the University of Manchester. I'm absolutely delighted today to be joined by Dr Suzanne Johnson as we introduce our part-time and online learning course, Transformative Oncology.
Thanks, Hazel.
So in today's session, we're going to give you a bit of an overview of our Transformative Oncology course. And we are going to be covering things like the course aims and objectives, the types of learning that you will take part in as you take part in this course, and a bit more about the entry requirements and who this course is for. We'll also be covering a little bit more about Manchester's cancer research landscape. And this will give you a bit of insight into how this course forms part of the bigger picture. At the end of today's session, we'll also be holding questions and answers, and you can submit your questions throughout the webinar today using the question and answer section in Zoom. We'll come to these at the end of the session, and any questions that we don't have time to answer, we'll follow up with afterwards in an email to make sure you get the correct answers. So I'm now just going to quickly introduce myself a little bit more. We'll both introduce ourselves, myself and Suze, before we move on to the main session. So as I said, my name is Hazel Craven and I am your dedicated course advisor for Transformative Oncology. I'm here to support and guide you through the application and decision-making process from right now where you just want to find out a little bit more about the course and you're deciding whether that's right for you, right through to offering that personalised advice and assistance and helping you to prepare your application. I'm here to answer any questions that you may have, and I can do that via email or through Zoom and telephone consultations as well. And you can contact me through studyonline@manchester.ac.uk. I will put these contact details up at the end, so there's no need to write them down just now.
Thanks, Hazel. Hi, everyone. I'm absolutely delighted to introduce our new Masters programme today. I've been conducting research into cancer for over 20 years and have had the opportunity to witness research ideas translate directly into clinical interventions. My particular research focus has been on extracellular vesicles. These are small packages which are released by cancer cells, and if they're internalised by normal cells, they can result in a change in behaviour. They can also carry markers which are from the parent cells, and therefore they can be useful as biomarkers for disease monitoring. As my divisional lead role for social responsibility, I've also developed a really keen interest in addressing cancer and health inequalities. And my work there includes establishing effective community engagement and patient involvement strategies, which really underpin our research and teaching practice. So both of these experiences have enabled me to develop an engaging and an up-to-minute training programme for those interested in oncology. And today, really, we're here to give you a taster of this programme. So what is transformative oncology? Now the next slide. Thank you, Hazel. So this is a progressive master's level training, and it's really designed to provide you with the skills to effectively transform clinical outcomes for patients with cancer. So throughout this programme, you will learn with access to real world evidence and cutting edge research, which is delivered by Manchester's world experts. You will understand the importance of multidisciplinary team working. And this programme of learning will really equip you with the broad knowledge and understanding to achieve effective personalised cancer care, whichever your role is. So the learning objectives for this programme include learning from, as I said, the world-renowned cancer specialists and researchers that we have here in Manchester. And this includes cutting edge technology and also a real interest in embracing the diversity of the population that we seek to serve to make sure that we really meet the whole population needs. You will develop new interdisciplinary approaches to really help to expedite the early detection of cancer, and learn to understand the importance of really getting to grips with the patient pathway so that we can aim to develop personalised strategy for cancer treatment. The programme is designed to really encourage intellectual curiosity and creative and critical thinking so that you can incorporate technology and innovation throughout the cancer pathway. And you will develop a whole range of transferable skills which will enable lifelong learning and equip you to lead and evolve with the changing needs of cancer care. So Transformative Oncology is available as a master's, a PG or postgraduate diploma, or a postgraduate certificate. The study is 100% online. The 15 credit units will be taught in eight blocks, and there are 8 taught units which we'll describe in a bit more detail after this. And these units are really progressive, so they really capture the cutting edge research and the innovative approaches that I've described, and they're medically applicable, really to set you up to work within oncology for the 21st century. And the programme is designed to be really flexible, which means that you can study when it suits you and tailor your learning throughout the master's programme around your work and any other commitments. And the current costs of these programmes are described at the bottom of this slide. So if you choose to take the full MSc, that's £15,000. For the postgraduate diploma, that's £10,000, and for the PG cert, that's £5,000. So the course is structured in a way which will enable you to build a pathway to a master's degree. And as I said, the 8 taught units are worth 15 credits each. So our postgraduate certificate delivers 4 units which focus on the tumour, the patient, different therapies, and then really define the different approaches to oncology treatment. So in understanding the challenges of tumour biology, we're bringing really up-to-date understanding with respect to detection and treatment. The importance of recognising underlying complexities of each individual tumour and of the patient builds essential knowledge as we move towards precision oncology. And in the 3rd unit, we'll cover present and future treatment strategies with a real focus on how to harness the body's own immune system to improve treatment response. And importantly, in the 4th unit of the PG cert, we look at the different branches of oncology and how they can work synergistically to provide the most effective cancer treatment. So if you choose to progress to the PG diploma, you will meet some of our world-class researchers as we explore Manchester's strengths in radiotherapy, early detection, and personalised medicine, and how we lead a multidisciplinary, team-working, patient-centred research and really develop an inclusive practice to deliver the best possible cancer care. You'll reflect on all of this learning as you set your own practice-changing priorities. Our master's programme brings the opportunity to either continue your learning online, to broaden your research skills with our Research Skills in Practice module, which covers essential expertise, including how to formulate a research question, design study methodology, and effectively communicate your research. Alternatively, you can gain valuable hands-on experience through research or clinical placement, either in a specific area of your choice, either in your home country or perhaps right here in Manchester. So you're wondering if the course is right for you.
Yeah, that's right. So you probably are wondering if this course is right for you. This course is going to give you an opportunity to learn from experts and work alongside peers across the world. The flexible learning options will allow you to work at your own pace, and materials will be released through a virtual learning environment as well, which means that you don't have to work through everything all at once as you may do in a lecture. You can work through it in smaller chunks or refer back to things at a time that's convenient to you. So this course is suitable for a really wide range of people. You might be a trainee doctor, a clinical nurse specialist, laboratory researcher or a manager, or an allied healthcare professional. This course will increase your knowledge to help you move into the field of oncology, but also help you build that global network. You'll be able to collaborate and learn alongside professionals from the variety of backgrounds mentioned above to truly build up that network, not just globally, but across different disciplines as well. So for this course, the entry requirements that we have is that we require you to have an honours degree with a minimum classification of upper second class or the overseas equivalent. And for that, you need to have one of the following subjects: medicine, dentistry, or another subject that's allied to medicine, such as biosciences, nursing, or pharmacy. And in submitting an application, you'll also need to make sure that you provide sufficient evidence of the relevant units that you've taken, usually through a degree transcript. If English isn't your first language, then we may also need to ask you to demonstrate your English language proficiency. And that's to the equivalent of 6.5 overall and a minimum of 6 for writing in the IELTS academic. We do accept a variety of English language tests, so that isn't something that you need to be worried about. And if you are concerned at all, then you can get in touch with me and I can advise you further. You also don't need to have that English language test at the time that you apply. We can make you an offer conditional on you achieving that English language test result. When you're applying, you'll need to submit and complete an application form and provide a copy of your degree certificate and your degree transcript. You'll also need to provide us with 2 professional or academic references and a CV detailing your professional experience. If there's anything in particular that you want to highlight that is maybe not immediately obvious by a job title, then we recommend that you do that in your CV. And we also request that you submit a 500-word personal statement to explain why you want to study the course. Again, if there's anything that's not immediately obvious from the other documents that you have submitted, the personal statement is a great place to highlight those experiences and those skills that you have. If you've got any questions about entry requirements, then you can get in touch with me. My email address will be up at the end of the webinar today, and we can discuss this in more detail, and I can help you to prepare an application to give you the best possible chance for admission onto this programme. We're now going to move on and discuss a little bit more about the wider picture of the Manchester cancer research landscape.
Thanks, Hazel. So the cancer research landscape in Manchester is unique. The Manchester Cancer Research Centre has a vision of creating a future which is free from the burden of cancer, and its unique partnership with the University of Manchester, Cancer Research UK and the Christie Hospital Foundation Trust allows us to really push the boundaries of our collective understanding. The university is internationally recognised as the world-leading university, and cancer is one of 5 beacons of excellence here. CRUK is one of the world's largest funder of cancer research, and the Christie itself is a world-leading specialist cancer treatment centre and the largest single-site cancer centre in Europe, treating some 44,000 patients per year. So cancer research in Manchester exists really as a nexus where the research is interconnected and collaborative. It's world-leading and impactful. And where possible, it's possible to translate findings in the lab into better, more effective treatments for patients. So let's just briefly explore some of the examples of this. So at the Christie Hospital in 2018, we became the first NHS site to treat patients with high energy proton beam therapy. So our research is central to this clinical provision and will ensure that patients always have the access to the latest developments in the field. We also use pioneering approaches in cancer screening, including Scans in Vans pilot scheme, which ran out of Manchester, which provided lung health checks in the community and has led to an increase in early detection of treatable lung cancer. In Stephen Taylor's lab, they've generated a living biobank, and this work has recently been published in Nature. They've produced personalised avatars of ovarian cancer patients, and these are now being used to guide personalised therapy and clinical decision-making. Ananya Chowdhury is leading the use of technology in clinical oncology. The Magnetic Resonance Linear Accelerator, or MR-LINAC, combines 2 technologies, MRI scanner and a linear accelerator, to precisely locate tumours, tailor the shape of X-ray beams in real time, and accurately deliver doses of radiation to moving tumours. And whilst our experts in cancer genomics are contributing to the global understanding of cancer cell evolution and progression, and again, this work has recently been published in Nature. And we have clinical researchers who've directly changed standard of care procedures in acute lymphoblastic leukemia and endometrial cancer through the implementation of their research findings. And we're delighted to be able to use these as case studies and exemplars as the foundation of our teaching within this programme. In many cases, you will hear directly from those pioneering individuals as you progress through the programme. And with the connections of many of our researchers and clinicians have around the globe, you will also benefit from a holistic understanding of current approaches and discoveries, which are elevating the field of oncology. Your learning will take full advantage of these global industry links, and you will also benefit from the experiences of your global peers through interactions and discussions throughout the programme.
Okay, so thank you so much for that brilliant overview, Suze, of all the work that's taking place in Manchester. We're now going to open up for any questions. So if you have anything that you'd like to ask, then please do submit your questions through the question and answer function. So the first question that we have is, I want to understand what my week looks like if I'm studying the course. Please, can you advise? How many hours of online teaching will I have, and are there exams at the end, or will it be coursework based?
So perfect question to start us off. So the taught units are arranged in 8-week blocks, and they are broken down into 3 different elements. So there's a period of 2 weeks for each of these elements, which is approximately 15 to 16 hours a week of study. And then there's an additional 2 weeks at the end for assessments and preparation for assessments. The assessments are slightly varied depending on the unit, but we do both, it's mostly coursework and also multiple choice questions. So it might be describing a case study, or it might be looking at a particular clinical practice.
Brilliant, thank you, Suze. So that's the one question that we've had submitted. If anybody else would like to submit a question, then there are a few moments just now for you to do so. I mean, a question from me really for you, Suze, is what would you say to someone if you were trying to explain to them why should they take this course? Why is it the right course for them?
I would say that this course is unlike many of the other courses that are available. The flexibility that we bring by having it as a thoroughly online course means that you can integrate what you're learning directly into your practice, and you can access it in a really flexible way. We are giving people the opportunity to hear some of the decision making that our experts have taken to really push oncology through to those transforming clinical decisions to really improve patient care. And the start of the unit, the very beginning, when we start to look at the biology of the tumour, it's really doing it from this point forward. We're not taking a historical view. You're going to be learning the absolute latest discoveries and knowledge and information that directly impacts on what your treatment or what your care package might look like for that particular cancer.
That's amazing, thank you. And we've had another question submitted as well, just asking, is this course eligible for people who are based in Africa? And this is from an oncology nurse who is based in Kenya.
Absolutely. So we are open for the global campus, and we really encourage applications from all over the globe. In Manchester at the moment, we are creating an alliance with Kenya. In fact, there's a UK Kenya alliance, and we're very, very keen to engage with our colleagues over in Kenya.
That's brilliant, thank you, Suze. Okay, so that looks like that's the end of our questions. The Q&A will remain open for the next couple of minutes in case anybody else has anything that they do want to ask. So please do type those questions in if that's the case. Yes, we do have another person here asking, can you enroll using previous level 7 study? So level 7 being master's study. So you would, your previous study doesn't necessarily exclude you at all from studying another master's course. So if you've studied at level 7 in the past, that doesn't mean that you won't be accepted to study again. So I would say that that's not a problem at all. If you do want to follow this up and have another conversation about your more specific circumstances, then I would encourage you to get in touch with me by emailing studyonline@manchester.ac.uk. And if you could just send across a little bit more about your educational background, then I can get back to you and offer you some more personalised advice on that as well. But I would say that yes, that you would still be able to enroll on this course. Okay, and if there's not any more questions, then what I'm going to do is I'm just going to share my screen again and bring up my contact details. So if you do have any further questions about the course, or would like to discuss anything in any more detail, then you can get in touch with me by emailing studyonline@manchester.ac.uk. I've also put my phone number up here on the screen as well, so you can either ring or call or send a message through WhatsApp, and I'll be able to get back to you and answer any more questions that you do have about this course as well. As we draw this webinar to a close, I just want to say thank you to everybody who has attended today and for your questions and being such an engaged audience. If you are watching this webinar back as well, thank you very much for your time and taking the time out of your day. So thank you everyone for taking the time out of your day today once again to join us as we introduced Transformative Oncology. I hope very much that you found the session useful, and please do get in touch with me if you want to discuss this in any more detail. Thanks very much. Bye.